In the past, for patients with delirium or agitation, medication like antipsychotics or benzodiazepines would be the first option for treatment. While drugs like these can make a patient more manageable, they do little to address the root causes of delirium. And once the drugs wear off, the patient is right back where they started. Untreated delirium can lead to long-term psychological trauma, ongoing nightmares, flashbacks, and anxiety. Importantly, it can also increase hospital length of stay and mortality. So, how can we do better? Research shows that being stressed, isolated, in pain, or dehydrated makes delirium worse, while feeling safe and comfortable can help to reduce and prevent it, which is why good delirium care today starts with assessing and addressing these basic needs. We can use the PINCH-ME acronym when checking for treatable causes of delirium. This means examining the patient for pain, infection and isolation, nutrition, constipation or communication issues, hydration, medication and mobility, and crucially, their environment and electrolyte levels. There are a number of different drugs that can induce delirium or make it worse. Wherever these drugs are used, carefully weigh positive effects against side effects and see if they can be reduced or stopped. Drug withdrawal can also cause issues and should be managed carefully. Disruption to the natural healing rhythm of sleep exacerbates delirium. We can help by providing natural light and encouraging patients to keep to their normal sleep pattern as much as possible. Poor hydration can also be a cause, so if a patient shows any signs of delirium, review their fluid balance. And if they are dehydrated, deliver fluids where appropriate and ensure that their intake is closely monitored. Being unable to follow what's going on around you or communicate how you feel can be frustrating and frightening. If a patient has glasses or dentures, they should be cleaned regularly and used. Hearing aids or amplifiers should also be worn and kept charged or stocked with batteries. People feel more comfortable when they know where and when they are, and what's expected of them. Clocks and calendars can help, as can frequent reminders about which hospital they are in and how they got there. When providing treatment, always explain who you are, what you are doing, and why. Listening, empathizing, and reassuring our patients makes them feel safe. Getting to know me boards help us to find topics for friendly small talk, enabling us to speak to our patients frequently, but just for short periods if they get tired easily. When speaking, we should use a soft voice and simple, short sentences. We should speak slower, try not to confront them or dispute anything, and instead just acknowledge the emotion behind what they are saying. The things we say without speaking are also important, so try to use open, visible body language. Move slowly and avoid making sudden moves or gestures that make it look like you might be giving orders or criticizing. Being surrounded by familiar things also makes us feel safe. So ask visitors to drop off comforting belongings that can be placed where it's easy for patients to see or reach them. When someone who knows our patients well tells us that they seem confused, we should listen, as this may be the first clue that points towards delirium. Encouraging friends and family to sit and talk with patients allows them more opportunities to see if something is wrong, and can also help combat isolation and disorientation. Last but not least, it's a good idea to supply reading material and encourage patients to do simple puzzles or word searches, listen to audio or watch TV. Anything that can keep their mind active. If they seem bored, offering to set up a call with a loved one can also help raise morale. This checklist of suggestions represents small changes in our behaviour that will add up to create giant leaps in our patients' experience. They are designed to be a set of simple, common-sense tools to help control delirium, and, when embedded in the culture of the ward, may even help to prevent it from developing in the first place.